In this video, I'm going to teach you the analytical approach. This is an approach I use after I use the other approaches like the ABCD approach, the red flag and routine approach, and the slicing approach. I use this approach especially when there is additional information given in the scenario. So let's take our example. So your patient is 5-year-old boy Lucas who has fever, headache and vomiting. Lucas is fully immunized. He has no significant past history. So I usually use this analytical approach whenever I look at the rest of the symptoms, something like or rest of the information that is given in the scenario. In this particular scenario, the rest of the information or additional information that is given is Lucas is fully immunized and he has no significant past history. So this is when I usually use my analytical approach. I will usually ask myself, why is it they have given that Lucas is fully immunized? What is the reason? So I try to analyze things. And again, I will ask myself, why did they give that he has no significant past history? How is this relevant? Because sometimes in some scenarios, there will be information like this. Lucas is on, atenolol or bisoprolol, which is a beta blocker. So that's when you use this analytical approach, where you will ask, why is Lucas on, atenolol, which is a beta blocker, in someone with fever, headache and vomiting? Why did they give this information? How is this relevant to my symptoms? See, once you ask these questions, it's always important you're as critical as possible. Try to analyze, try to use such strategies, because once you ask questions, you will get a better idea. For example, a patient has come to you with pain in his right big toe. And in this scenario, if they have given he is on thiazide diuretics and he drinks 6 beers a day. So you should ask yourself, why did they mention this word thiazide diuretics? How is this relevant to my pain in the big toe? And why did they give about drinking of 6 beers per day? There must be a reason. So try to analyze. Again, you're only brainstorming here. Don't go too much into the depth there. So try to ask yourself, why did they give this piece of additional information here? How is this significant? How is this related to my symptom? Once you ask this question, believe me, you will get lots of answers. And this is how you're going to lead your scenario or lead your case once you enter the room. This is how you're planning your scenario, and this is how you plan your management. For example, the patient is drinking 20 beers. In your management, you're not only talking about, how you're treating this acute gout, but you should talk about the prevention aspects as well. Like, treating the triggering factors like drinking excessive beer, or, maybe change of medications, like maybe you have to change the medication to a different kind of medication. I hope you got this point here. So the analytical approach is when you're actually asking the other things, like why is this additional information given? Or they might say something like this: John has got chest pain, he is a manager in a bank, and his BMI or body mass index is 38. So ask yourself, why did they tell that he is a bank manager? How is this bank manager job related to the chest pain? Oh, okay, so bank manager is a stressful job. So stress, which is a risk factor or a trigger for chest pain, and BMI of 38. So this gentleman is very obese. So lifestyle. Okay, so in the management, I'm not only treating his chest pain, but I'm going to talk about stress management. I'm going to talk about lifestyle. I'm going to talk about diet. I'm going to talk about exercise. See, I hope you got this. See, this is how I used to brainstorm outside the room. And once you ask questions, you will get a clear idea. And once you get some answers for your questions, you will go inside the room and you plan your scenario.